better. Thank you.
Okay, and we're recording.
Good morning. I'm 𝘾𝙊𝙉𝙉𝙑𝙍. I'm one of the co-chairs of the AEC this year, and I'd like to introduce Amer and Munira. They're going to talk today about their son using a clinical trial for treatment for achondroplasia. So we'll get started. Welcome.
Hi, Kelly. Thank you.
Hey, good morning.
I think I'd like to start talking about the diagnosis of achondroplasia for your son.
Yeah, so Ahmin was diagnosed at 9 months of age. I had taken him in for a 9-month well visit. And for me, it was an ordinary day and an ordinary doctor's visit, except I walked into the office and walked out with a major life-changing diagnosis in my hands. So it turned out to be not so ordinary for me. As usual, the pediatrician charted his head circumference and body length on the chart, and at 9 months of age, his head circumference was disproportionately large, so large that it was in the 99th percentile, and body length below 5th percentile, so that he could not be charted. And that led the pediatrician to pediatrician's curiosity led her to observe other symptoms in Ahmin's physiology that were telling of a diagnosis. She left me in the patient room for 10-15 minutes, came back with a Xeroxed copy of an article on achondroplasia from, I believe, a medical encyclopedia, gave me a referral for geneticists at the local Lucille Packard Children's Hospital, gave me a hug. She said, I suspect this is a diagnosis of achondroplasia. You need to speak with these geneticists. And I was on my way out afterwards. And I remember sitting in the parking lot of the doctor's office and calling Amer immediately and saying, hey, I think we have a diagnosis in our hands.
Wow. And before that, you didn't have any suspicions that there was anything wrong.
You know, hindsight is 20/20. So yes.
Well, you're not physicians, so it's not that surprising.
There was no official diagnosis, but I look back to moments when I would be giving him a bath before that 9-month diagnosis, and I'm noticing the kyphosis, the outward curvature in his spine, and wondering if that was curious. In the passing, some physicians in the family, some grandmas had commented, oh, his head is a little big. And once or twice we'd woken up in the middle of the night having heard his disrupted breathing, but having not known anything about sleep apnea. Sure. I remember rushing him once to the hospital once before that diagnosis, but really coming back home with nothing in our hands. So in hindsight, all of these look like parts of a puzzle that we were supposed to bring together, sure, but having had no major diagnosis in the family of any kind, sure, we were not onto this path of thinking.
Sure. That sounds very appropriate. And it's interesting that you say that she hugged you. How did you receive that hug?
I appreciated it. Of course, I remember it to this day. I think empathy on a physician's part is it's important. It's important to not just be treated like a subject or that needs to be treated just clinically and almost mechanically.
Great, thank you. I'd like you to talk a little bit now, if you wouldn't mind, about how you started the process of trying to get treatment for achondroplasia for your son.
The clinical journey,
yeah.
The journey of care. So the journey of care in achondroplasia is complex because it's a skeletal dysplasia, so it affects the body from head to foot, really different zones in the body, and so it was a very rapid learning curve of learning what it is that needs to be, addressed, monitored, kept an eye on. Mm-hmm. Some of our learning came from the internet. a lot of the times it was more than just websites on achondroplasia or web articles, but it was really medical journal articles. So much so that I remember visiting the skeletal dysplasia clinic at Hopkins and talking to the doctor about, my son's eustachian tubes. And my, brother-in-law who's a physician said, whoa, that doctor was probably taken aback by your use of medical terms. But I think we wanted to arm ourselves with as much knowledge as possible. We ultimately got plugged into orthopedics, ENT, for some time, occupational and physical therapy. Neurosurgery is very critical in the first 5 years of life, a little bit of pulmonology, but really that veered into ENT. And am I missing anything?
Orthopedics, you already said, yeah.
Yeah. Those were the big ones. Orthopedics followed both spine and legs. Neurosurgery followed both for hydrocephalus and foramen magnum stenosis. And ENT was, ENT is not as life-threatening, but more, it kept us busiest because we had a lot of ear infections and ultimately tonsillectomy, adenoidectomy. And that's what caused the daily toll of vomiting and the daily cleanups and the daily, oh my God, is my child getting enough nutrition? He's vomiting back his breast milk. That's what kept us busy on a daily basis, his ENT issues.
Thank you. How about, tell us about the genetic diagnosis, the gene test.
Yeah, so the genetic diagnosis happened in, I would say, 3 parts. First was just, when you know achondroplasia, you can look at someone with achondroplasia and tell. The symptoms are so obvious physiologically. We were sent, while we were waiting for our Lucille Packard appointment to happen, we having, access to local resources, went to our pediatric orthopedist whom we'd known for our older child. He took Ahmin in, did some, measuring tape measurements and said, you do need to do blood work, but I think you should be prepared for a diagnosis. He sent us to Quest Diagnostics. We followed instructions, and Quest lost our blood samples. And I remember that was—
We probably shouldn't talk about Quest specifically. We're just going to say the genetics lab, okay?
Okay, the genetics lab, they lost our blood sample. And you have to understand that this is a period of great uncertainty where we're being told by both the pediatrician and the pediatric orthopedic that there is probably an impending diagnosis. And I think we're going through a stage of denial, which I think is the first stage of grieving.
Sure.
We're hoping for a lack of diagnosis and to be told that the blood work is lost, and to talk to some customer service associate on the phone who really was not tuned into our emotional state. It felt cold and callous. And then ultimately we gave up on that blood work yielding any results. And we went to Lucille Packard, where we were, met with a very kind genetic counselor who displayed a tremendous amount of empathy. Again, just by measuring and looking at Ahmin, she confirmed the diagnosis, but of course she wanted to be scientific and very methodical about it too. So we sent in the blood work, and that confirmed the diagnosis ultimately.
Okay, thank you. Thank you very much. And how old was he when he got that diagnosis?
Less than 10 months.
Okay, great. All right. So Amer, why don't you tell us about your pursuit of trying to get treatment for Ahmin and others?
Yeah, absolutely. Thank you. So when we went to the geneticist, and the first question we asked is, what can we do? What is the path looking forward? And what we learned is that in achondroplasia, it's really a wait and see. So you've got the diagnosis, now just wait and see and manage it. So if an issue comes up, then a surgeon, typically surgeons will come in and make some appropriate corrections, and the life will continue. And my big question was, can we do anything that's going to get ahead of these potential medical complications? Because we do remember that, we do know that in some children, they actually have no surgeries for achondroplasia. There is a certain percentage of population, but then there's a vast majority of people with achondroplasia have to go through multiple surgeries, have to live with pain. It does impact their life, and they have these complications. So can we get ahead of those? Because we don't know what lies in the future for Ahmin. And so there's a lot of anxiety because of that. And so what we did is started to really think deeply, what can we do? Can we create a foundation? Can we start funding doctors? Can we talk to doctors? And one thing I would say is that the prevailing feedback we got is just wait and see your parents. You really can't do much, and just listen to your doctors. But what I did find, there was this very interesting movie called Extraordinary Measures that I got a chance to see, and it talks about how this family basically helped fund scientific research to help improve or accelerate the development of therapies. And so we got in touch with different doctors in the space. Specifically, there's the leaders in the space. There's Dr. Horton is one that comes to mind, Dr. Wilcox, Dr. David Ramon. These guys are giants in this space. And we were able to connect with them, figure out how much could we help, what can we do? And one is, of course, raise funding to help them fund their research. Now, as one thing I'd like to mention, as someone's coming from the outside, I thought this is going to be a huge amount of money. But when I talked to the researchers, they said, oh, a couple $100K will make a lot of progress. And I said, how will that work? And they said, well, because they have these research assistants, and they have a full lab, but just with a couple $100K, they could fund 2 to 3 years of research of an RA. And that does two important things. One is it brings in great minds into the field who otherwise would probably not come. So if an RA gets into a field and spends some 2-3 years of their research there, they come into the field. And second, they have some really interesting ideas that if they have the data, that can attract more funding. And so we started an organization called Growing Stronger. That organization raised some funds. We distributed those funds to some of the researchers. And one of the research outcomes was a very critical biomarker that's being used by pretty much all the pharmaceuticals that are developing therapies for achondroplasia. And that's really helped accelerate the science and the clinical trials. In addition to that, we've also, one of the big areas we found is that there's a lot of, the first thing we did is went to the LPA and got a lot of support from the LPA, but we feel there needs to be a website where parents can see what other parents have done to help, to feel empowered and activated. Because when you find this diagnosis or any diagnosis, the first reaction for many parents is to say, what can we do? And there should be, we don't present a roadmap to parents to say, here's what you can do. And I think some folks can raise funding, some people can do volunteer work, some people can go, do arrange bike rides, whatever it is, there should be some framework that helps the parents. And so that's been our journey, and Growing Stronger is still active today. And we've got a new videos and websites and so forth coming up that really are target furthering the science, improving on what we already know, and really improving the quality of medical care for little people.
Wonderful. Really amazing what you've accomplished. Can you speak a little bit about how doing all of that helps you deal with Ahmin's diagnosis personally?
Yes. So as a dad, the first thing you want to do is do the best you can for your family. That's kind of the natural human instinct. And so what I was able, so I think having the ability to make a difference, see that not only the work we're doing is going to impact, potentially impact Ahmin, because we didn't know if all the work we're going to do is going to put together science that will help Ahmin in his lifetime. But just even knowing that it can impact his future generations or other generations to come was very empowering. And so I think that was really big help for us, at least for me, to go through that time and feel like we did the best we could for our kid.
Sure, sure. I know a lot of people going through this process feel like they don't have a lot of power, and it sounds like you were able to help that through this process, help that feeling of being out of control through this process.
Yeah,
Great, wonderful.
Yeah, so I wanted to talk a little bit about this can-do attitude.
Sure.
I found us returning to that theme consistently. First, there was this idea of for taking care of our child, we just had to roll up our sleeves and do a deep dive into his care.
Yes.
That we've talked about already. Then the other was approaching some of these scientists. I had the impression that these were, busy scientists in their ivory towers doing their research.
Yeah.
And so just when I remember writing my first email to Dr. Horton, who's a leading researcher in the field, and really not expecting anything in return, not expecting a response. But we did, and that was followed up by a phone call, and the rest is history.
Yeah.
But I realized in the journey how much the parents' voice matters, and how much physicians and researchers appreciate that the parents' voice is so weighty, because we are one of the biggest stakeholders.
Yes, yes.
And we are probably the ones driven most, with no promise of reward or compensation, but we'll keep giving it our best, because
Yes.
we are driven from our very core. And so we get a lot of response from everywhere. So I think every parent should feel very empowered in this process, and know that their voice will be received as a very important voice in the process.
Thank you very much for saying that. I don't think that most parents realize that, and I think it's good for our attendees today to think about that and to talk about that with their families. I know, Amer, that you're an entrepreneur, and so you're probably a little more experienced at making cold calls like these to people that you haven't met before, but certainly to tell us that other families should expect some reasonable response is really helpful. I mean, I don't know that other people would have been as brave to do that right away.
Yeah.
That's wonderful. Thank you. Now let's talk a little bit about how the treatment started for Ahmin.
Yeah, I'd like to return to the same theme of can-do attitude. We did not receive an advertisement for the clinical trial enrollment. It wasn't handed over to us in some widely circulated pamphlet or flyer. We had to, poke around, ask around, use our network of friends and family to find out where the trials were taking place, and then reaching out to the study site and saying, hey, we're a family, we're interested in enrolling, and let us know how we can go about the process. So we just had to, it was again, persistence, and then just jumping on the moment of opportunity once it did appear.
And from what I've heard, for example, the board at Little People of America was not necessarily happy about the explorations into treatments. So why don't you talk about that a little bit?
Yeah. So first, I mean, when we first got the diagnosis, one of the first things we did is call Little People of America, and they're very, very supportive in terms of giving us a roadmap of not exactly what we can do medically, but what is in store for Ahmin. So there's lawyers, there's doctors, there's entrepreneurs. The future for little people is very bright.
Yes,
right? There is no issue there. Of course, they have medical conditions that they may need to deal with, like we have an Olympian, right? A Paralympian, multiple people, and she's a world record, right? Holder like 5 times or something. So
what's her name?
Ellie Simmons.
Yes.
And so she's from the UK, and so just an amazing person. And so that was really good. And then when we did try to approach we approached the LPA with ideas on what we can do to expand the medical science and therapies. There was quite a division within the response from LPA. And on one side, folks were saying, look, we understand your parents, let's listen to what you have to say here. And the other side was, we've gone down this path before, and they consider it and they don't appreciate that someone wants to come in and try to change them, right? And I can totally understand that perspective. It took us a little time to understand, but we can totally understand their perspective to say, yes, from their perspective, this is who they are. They're little people, and why are you trying to change them? We don't need to change them for them to have a better life or quality of life. And that really then helped us understand it's not about quality of life, it's about quality of medical care.
Yes.
And that's where we were able to really find common ground ultimately, that it's about quality of medical care, because little people do not get good quality of medical care because I'll quickly go through. One is because of insurance reasons. Typically, the children are sent to a pediatrician who has not seen little people before, people with achondroplasia. And because of that, there could be mismanagement. The risk of mismanagement is higher, and the rate of complications is proven to be higher. So really understanding, you need to go to an expert. And there's a medical advisory board for little people in America, and they see the majority of the cases. And so they have a lot more experience, even just simple things like anesthesia for these kids, right? In our case, it took 9 months to even get a diagnosis, right? Because the doctor did not see what was in front of them. Now, so that's, I would say, so 𝘾𝙑𝙍𝙑 has been a supporter, a friend. We've raised money for 𝘾𝙑𝙍. We continue to be part of them. They're awesome. And they've come through the journey too. Now, it's really interesting. Some folks in 𝘾𝙑𝙍 still are not supportive of the therapy, but many are like, this is here to stay, and it's an option for parents, and it needs to be well documented, and needs to be, and their position statement is, explore what's best for your family.
That's great. So it sounds like you've had to do a little bit of like diplomacy through 𝘾𝙑𝙍𝙑 sounds like you learned and they learned from the process.
Yes, absolutely. And it was a very good process. It really helped us. Our whole mission statement of improving the quality of medical care, not quality of life, but quality of medical care, that critical part of our mission really came from the deep discussions and friendships we made at 𝘾𝙑𝙍𝙑.
Wonderful. I know when I talked to you both earlier, one of the things that you had talked about is when you first got the diagnosis, and knowing what you knew without having been a parent of a child with achondroplasia, about people who have dwarfism, how it was difficult to have hope. Munira, would you talk about that a little bit?
Yeah, I think our experience with dwarfism was like anyone's experience is through really popular culture. So we all grew up reading Snow White and the Seven Dwarfs. We are aware of, mythical, magical creatures that, travel through town and traveling circuses, etc. I grew up in Pakistan. My experience with little people had been seeing them as doormen to fancy hotels, probably for unfortunately for the exoticism element that they offer, so I really had to stop and say, really, like, reimagine all of those cultural expressions of dwarfism and look at it through the lens of rare disease. That this is a genetic mutation that results in short stature, and it's more than short stature. It's a skeletal dysplasia, and so it needs to be addressed clinically, and it needs to be addressed from a social and emotional perspective. So that was my shift of perspective.
Sure. And it sounds like Little People of America really helped you to find that hope.
Yes, Little People of America, that bustling community, that tremendous amount of pride in dwarfism, you're come one, come all, we're in this together, was very supportive.
Wonderful. Okay, thank you. Now let's switch over to talking about how the treatment has gone for Ahmin.
Yeah, Ahmin takes a daily injection. That's really our commitment on a day-to-day basis. It's the discipline surrounding having to take the medicine vial out 30 minutes prior to injection, reconstituting it, drawing it in the syringe up to the required amount, making sure there's no air bubbles, and then poking, and that's it. Does it take an emotional toll on a young man, little boy taking a daily poke? Yes, it does take a toll. It's over really fast, but he does a lot of thinking before he gets the poke. On a logistical level, we've had to think about the refrigeration of the medicine vials when we travel. Once we lost electricity in the house, and the first thing we worried about was the medicine.
Sure.
We have ice coolers handy. Prior to sending him to summer camp, we make sure that the camp counselors know that he's going to be injecting himself. So those are the kinds of things we have to think about. Nothing that's not doable, but it requires a certain amount of logistical arrangement and, thought process.
For sure. And how old was he when he started getting the injections?
This was about three years ago almost now. So
he's been doing it for 3 years.
Almost, yeah.
And he's 14 now?
He's 13.
13. So he's been doing it from age 10 or 11 to
11-ish. He may be on his 2.5 year.
Yeah.
Okay. And so you did it at first, and now he does it?
Yes.
Okay. All right. And you also talked about you have to go.
I did a lot in the beginning.
He received training.
I was the first trainee.
So you learned how to do it, and now everybody in the family knows.
Everybody does it. Now I don't do it as much.
Yeah.
Okay.
Yeah.
Got it. And you also talked about kind of the burden of the trial, that you have to go to a lot of appointments, you have to drive to a lot of appointments. Why don't you talk about that?
Yes, again, the initial enrollment process was pretty intense. First of all, the site is about an hour away from where we live. So for the initial enrollment, where they wanted us to show up for, I think, 4 or 5 consecutive days for about 8 hours a day, it was, we just had to pause from life. And I remember Amer and I taking on, switching back and forth. So he went for a couple of days and I went for a couple of days, and we would go in with a certain mind frame. We'd pack our lunches, take our books, our computers. So it would feel like, it wouldn't take so much of a mental toll on us.
Sure.
Then the appointments, really, after that subsided, there were quarterly visits. So, manageable. We just have to tell Ahmin's teachers ahead of time that we'd be missing, half a day of school or a full day of school. Eventually, the clinical study started to reimburse us for they were always willing to reimburse us, but they actually started to provide transportation. Wonderful. So, and we always had, I think it's called a clinic card. They would reimburse us for our lunch and our gas money and our parking. So they were always really good about that. And now the visits are not even quarterly, they're twice a year.
Right.
So they've become a part of our routine. Again, we just go in with the mindset that this is one day of our 3-month quarter where we're going to go spend this much time and, come back with our medicines for the next 3 months.
Okay, great. Well, why don't you tell us a little bit about the pros of being in this trial, the benefits?
I am so grateful to medical science and for the opportunity to participate in trial. It makes us feel empowered that we are able to help our child avoid pain and medical complications. And I cannot imagine not having this option, and then the feeling, the wait and see, and the feeling of despair that comes along with that. So I consider ourselves to be very fortunate to be able to participate in this trial.
Have you seen benefits?
Ahmin is strong, physically strong. We, as a family, we decided that we were not going to obsess over his height. So you're not going to see any markings behind any doors in our house where we're, doing the pencil marks and saying, hey, you grew a centimeter. We don't measure that. We don't celebrate that. But was he able to swim a mile at Boy Scout camp twice in a row in 2 consecutive summers? Yes.
Wonderful.
Is able to more or less keep up with his peers during a hike? Yes, he's able to do that. Is he able to swim in the ocean? Yes, he's able to do that. And I think, yes, stature-wise, still he may have already, beat his predicted final height. And, we'll take it. We'll take it.
Yes, yes. Wonderful, wonderful. Anything else, Amer, for any benefits of the?
When you ask him, and he'll say that it's helped reduce a lot of pain that he had in his legs. And what we found is a very common surgery that all little people have is what they call an 8-plate, where basically the lower part of your leg has a curvature, and then it's that surgery helps straighten that part. He hasn't had that extreme bowing. And it did look like he was going to get that surgery because he did have bowing, but it doesn't look like it now. So I think just the way his leg is right now. And he said that he would have a lot of pain, and we would, really massage it and put heat on his joints, because he said they're putting a lot of pressure and stress. But he said, I haven't, that subsided significantly. And so we're, at least from his perspective, it feels right. And I know the FDA has approved the therapy.
Yes, congratulations.
Yeah, thank you. And so, there's a lot of data that supported in terms of, like when you're saying, we don't measure it, but ourselves, but of course the data is showing benefits, so we got approval. So I think we're very, very grateful, like Munira said, that live in an area where the trial is offered and being able to get part of it.
Absolutely. You live in San Francisco, is that right?
Yes, we live in Silicon Valley.
So certainly that's a place that has a lot more access to medical care and trials and research, things like that. Okay. Well, you've talked about a lot of things today. I really appreciate all of that. Is there anything else that you want to make sure that we know before we start talking with Ahmin?
Yeah, I guess one key point I'd like to mention is, as Munira was talking about Pakistan and we talked about Little People of America, I think one of the key things, two things I'd like to mention. One is for the audience here, really empowering your patients, saying they can do something and giving them a roadmap is key for really helping the parents, I think. And of course, there's a wide variety of things they can do, right? I think there's probably some research or some paper that should come out and say, what are things that parents can do? Because there's, based upon folks' resources, they're able to participate in different activities to empower themselves and really contribute towards science and the well-being of their child. And the second is this difference between empathy and sympathy. I think one of the key things that we learned is that and this is from the LPA, do not want sympathy. Sympathy is not good, not welcome, because no one wants to feel like you're feeling sad for them or bad for them. But there is empathy, and really being able to say, look, I can see your perspective, like their, a little person's perspective of why it's important for them to have this identity, or how they're feeling if people talk, if they're portrayed a certain way in the media. So I think that difference is really critical to manage and learn that through the process of being connected to the community.
Yeah, it sounds like that's a really important point for people to be striving for empathy versus sympathy.
Yeah,
that's really helpful for you to tell us. Is there anything else, Olivia, that you want to ask right now?
No, thank you. That was so wonderful.
Wonderful. Okay, let's stop that now.
How long did you?
Okay, now we're going to talk to Ahmin. He's 13 years old and he has achondroplasia. Hi, Ahmin.
Hi, good to see you guys.
Nice to see you. So I would like to ask you to tell us about how the treatment and the trial has gone for you. Can you start with what it was like when you first started the trial?
Well, yeah, when I was first started the trial, the injection part, I was a bit, it kind of bummed me out that I had to inject myself every day. I mean, like, I wasn't necessarily scared of needles before then. I just found them as a discomfort, but now I've kind of grown, like, it's like, now for me, it's something, all right, it's something I have to do. It sucks sometimes, but yeah, just get it done now. But something that stood out to me even more than the injection was the process of the placebo. I talked to some other people at Biomarin and they explained to me why the placebo was necessary, but I still would have wished that the placebo didn't happen, the placebo process never occurred, because if it had never occurred, then the whole time that was happening, I didn't know if I was actually getting the real drug. So I was injecting myself every day. We were going to long Oakland appointments and once about every 3 months. And I didn't even know if I was getting the real drug or not, if it was just getting a placebo. So yeah, that process, the whole process of the placebo, that was not the most enjoyable process for me. And yeah, but besides the injection and the besides the injection and the placebo, it was really just one other thing to do today. So it wasn't too horrible. Oh, but yeah, it wasn't like the worst thing in the world to do. But yeah, the injection was a slight discomfort at first, and the placebo process was not very fun, and to know if I was getting it or not. But yeah.
You have to take the injections daily, and you do them yourself now, right?
Yes.
So do you ever feel like you wish you didn't have to deal with that time that takes to prepare the medication and keep it cold and do the injection while other people could be doing other things?
I mean, it's not like an extreme inconvenience. I would prefer it if they just gave us like already syringes, or like insulin syringes, like they're already ready, right?
Yeah.
You just take it out of the fridge and then inject yourself. But
Yeah.
I wish we had something like that, where they just give us boxes of syringes with the right dosage and everything already in there. And also like, because since I should never, but yeah, I wish they gave us like boxes with the medication already inside. So all we have to do is take it out of the fridge and inject ourselves.
Sure, because for you, it's more time consuming to have to let it sit and to have to bring it into the needle.
Yeah, just something that just something that has to get done. But it would be a lot more convenient if they just had it in boxes with syringes, where we could just take it out and inject ourselves, so it could become closer to like a 30-second process rather than a whole like 30 to 40-minute process.
Sure, that makes sense. I hope you shared that with the company.
Yeah.
Have you?
I haven't actually talked to the people about to the workers at Biomarin that I met about it, but I did talk to some of the doctors at Oakland, and they said that Biomarin might be working on something similar to that.
Wonderful.
Yeah.
Great. And tell us what you feel has been any benefits of treatment. You've been on it for 3 years now.
So yeah, well, in terms of benefits, yes, the benefits are very valuable to me. Like what's on the top of my list is my growing pains. Like before I was on the treatment, at least like 2 to 3 times a week, like 2 to 3 times a week, I would have growing pains, and they would be very like almost not, I don't want to say excruciatingly painful, but close to that at my knee, like in the areas around my knees, and they were very painful. And I was like, it made mobility very hard for like for like at least an hour or two at one point. But then at one point in the night, but then once I started going on the drug, the growing pains, the rate at which the growing pains came subsided a lot, and it went from around 2 to 3 times a week to around just maybe once a month or even less than that.
That's wonderful. What else? Anything else?
And also, yes, I have grown taller. I believe my rate of growing taller has increased significantly. Like for example, now I hit 4 feet about a year. I want to say a year and a couple months ago, maybe. But once I hit 4 feet tall, I was able to go like for a lot of roller coasters. There's if you hit 4 feet tall, then you can go on them, because there's like they just have the benchmark for 4 feet tall. So I hit 4 feet tall, so I was able to go on a lot more roller coasters than I had been, because it's really just, in my experience, there's kiddie roller coasters, and once you hit 4 feet tall, then you can go on almost everything else. So once I hit 4 feet tall, I was able to go on all the sort of roller coasters, and yeah, that was really fun.
That's awesome.
Yeah, it was
Go ahead.
It was a good bonding experience for me and my friends. So yeah, that's something I really appreciate about the drug.
Sure. You also talked about feeling stronger and being able to do sports.
Yeah, sports have gotten easier. In terms of being stronger, I've been able to reach things better, right? Like now I can wrestle with my friends more, because before I had the drug, me and my friends always like wrestling with each other, but I would always come out on the bottom because of my short limbs. They didn't give me a good ability to wrestle. But now that my limbs have increased in length a bit, when I wrestle with my friends, it gives me more of a chance.
That's great. And you also do swimming, hiking, you do diving. You're on a diving team.
Yeah, diving is a sport I particularly enjoy.
Yeah. And you had said earlier that you felt stronger than you did before in terms of, swimming, diving, things like that. Is that right?
Yeah, they became easier as I grew taller.
Sure. Now, I know you have homeschool, and I know that's partly because of things like lots of doctor's appointments. And how does that go for you?
Homeschooling is, and I wouldn't want to say it's something like significant. Dwarfism significantly affected me. Having dwarfism significantly affected the decision for me to homeschool, because I did go to regular school for a year, and dwarfism didn't really affect that me switching back to homeschooling. What really affected is just my personal opinion. I feel like the schools, I don't work very well with the school system. So when I wanted to do homeschool, I wanted to focus on the subjects that I was, because like since I was little, I knew the subject I was passionate about. I was passionate about math and coding, right? And so I wanted to do homeschooling, and so I could focus on the subjects I was passionate about and pursue those.
I see. I think you have a whole family full of independent thinkers.
Thank you.
Don't you think, Olivia?
I do.
Definitely go-getters and passionate and smart. Is there anything else that you would want the genetic counselors who are attending this conference to know about the treatment that you've received for achondroplasia?
Well, I always tell everyone who I meet with the 3 things. I wish it wasn't an injection and could be and didn't have to go through the whole reconstitution process, then the placebo effect. And I just want to tell them thank you for everything that you guys have done, because it's really helped me.
Wow, wonderful. Thank you so much, Ahmin. That was wonderful. Thank you very much. We're going to look forward to having you guys back to do questions and answers at the time of the conference. Okay? Thank you very much.